So let's talk about the rheumatology visit and the consultation. Before you meet your physician, there may be a lot of anxiety and doubt in terms of what to expect, and a lot of information is coming to us at one time. So although we have all these emotions such as fear, doubt, anxiety, still get the consultation because it may not be as daunting as you may think. So what to expect at the first consultation? Patients present with a long history and they usually ask, where do you want me to start? And I always say at the beginning, what is significant in the history? Now sometimes you may dismiss symptoms that you might think, okay, is it important or not? So what I advise you to do is to tell your physician everything, right? From the time when you remember you were last healthy to what you're experiencing at the moment now. Is key to clinical diagnosis. After we have taken the history, then we go to examination, right? So a full head to toe examination of the scalp, looking for any rashes, any ulcers in the mouth, examination of the joint pains, assessing for a range of movement. And after we get this and we have a possible working diagnosis or some thoughts in our head, then we'll order particular investigations to key in what we may be thinking. Radiological examinations such as CT scans, x-rays, ultrasounds may be ordered, again to support the diagnosis. Rheumatologists love blood work and antibodies, but it's part of the specialty and it's part of the practice. Once we have all the information, a follow-up appointment is made for us to start the treatment plan that will be tailored to your needs. So, although we may be feeling a lot of things, I would advise, come and have a discussion, come and have an open mind, and then we'll discuss once we have the information what is best for you. So let's discuss some frequently asked questions during our consultations. Patients ask, how often would I need to see my rheumatologist? Which is an excellent question. And I'd say depending on the condition. So a lot of times we have the first consultation whereby we do the history and examination and then we order specific investigations. This is usually followed up with a second consultation, and depending on the diagnosis, frequency can range from on a monthly basis to every 3 to 4 months depending on the diagnosis. Usually once we start medications, because some of the medications can have side effects, I usually follow up with a 1-month visit to make sure everything is okay, and then we stagger accordingly as the need arise. More times than not, first consultation, the diagnosis is not always clear, but once we have specific investigations, by the follow-up appointment, we have better clarity as well as to manage your expectations and to guide treatment accordingly. Depending on the condition, there are certain tools and tricks that you can discuss with your rheumatologist in terms of how to get the best outcome at home and things that I can do for myself, but it depends on the condition. Never stop taking your medication. Anytime there's an adjustment to medication, discuss with your physician. I know it can be frustrating depending on the amount of medication and the pill burden of having to take medications every day. However, once we achieve remission, we can discuss cutting down on medication. If side effects is an issue, discuss with your physician. Medication may be stopped immediately, but there are certain medications that we need to continue or tailor on the specific regime, for example, steroids. So always discuss with your physician. Don't ever be afraid to discuss what to do with your medications with your physician. I always advise patients to keep a diary. A lot of rheumatologic conditions or autoimmune conditions experience brain fog. What does that mean? Some degree of forgetfulness, sometimes you get confused, and symptoms can be so varied. So I always advise patients to write down your symptoms so that at the consultation we can answer all your questions, concerns, and tease out any new symptoms that you may be experiencing. If you have never seen a rheumatologist, I would say reach out as soon as possible if you're experiencing symptoms of arthritis, hair loss, fatigue, or even positive blood tests that your GP may have ordered. Definitely seek out your rheumatologist.